So, good day everyone. By the way, my name is Rachel. So, for this morning, I will going to report the diagnosing psychological disorder. So, this operation that I have mentioned, so tell us what is unique about Frank, not what he may have in common with other individuals. So, it is how Frank may resemble other people in terms of problem. So, Frank frequent is important for several reasons. So, like for example, if the past people came in with similar problem, so we can go back and find a lot of information. So, from this case, we see how the problem began for those other individuals and how long the problem or disorder lasted. So next is idiographic strategy. So this information let us tailor our treatment to the person but to take advantage of the information. So if we want to determine what is unique about an individual's personality, cultural background, or circumstance, so we use what is known as an idiographic strategy. This is known as non-motoring strategy. So in other words, we are attempting to name or classify the problem when we identify specific psychological disorders such as mood disorder. So, and it is focused on individual that unique personal experience of human nature. So next is nomenclature. So what is nomenclature? So it describes the names or labels of the disorder that make up the nosology. So like for example, anxiety or disorders and depression. So yan ang mga example ng nomenclature. So those are the mental health problem that primarily affect a person's emotional state. So it is a disorder in which a person experience. So let's proceed by classification issues. So by the way, what is classification? So classification is at the heart of any science and much of what we said about common sense. So if we could not under and level object or experiences. So when we say classification, it is both referring simple to any effort to construct group or the categories. So classification called taxonomy. So which is classification in tiers for scientific purpose such as rock, insect, or if the subject is psychological disorder. So like for example, when you study insect or rock, so the classification there is knowing how one species of insect differ from others. Next is there are three methods of classification. So first is classical categorical approach, dimensional approach, and last is prototypical approach. So classical categorical approach, it is clearly inappropriate to the complexity of psychological disorder. According to the clinical categorical approach, clinical would know the cause of disorder. So when you say classical approach, so it is very important for physician to make accurate diagnosis and it is useful in medicine. And ito yung pagdidiskarte para suriin ang mga sakit ng tao. Halimbawa na lang, if your patient ay may a complaint by stomach pain, so yung doktor ay susuriin niya kung ano ang mga dahilan, so kung bakit nagka-cause siya ng stomach flu or infected appendix. So next to classical categorical approach is dimensional approach. So dimensional approach in which we note the variety of cognition, mood, and behavior. Ito ay kung saan napapansin ang iba't ibang kondisyon, mood, at pag-ugali. Kung saan ipinakita ng pasyente at binibilang ng mga to sa isang sukat. So like for example, on scale 1 to 10. So a patient might be rated as several anxious. 10, moderately depressed. So 5, and mildly manic. 2, to create a profile of emotional functioning. So this says most theories have not been able to agree on how many dimensional are required. Some says dimensional is enough. Another have identified as 33 million. So last is prototypical approach. This alternative approach identifies certain essential characteristics of an entity so that you can classify. So typical approach, so it is categorical approach but with the twice that is basically combine some features of each of the former approach called prototypical approach. So like for example, if someone were to ask you to describe a dog, so you could easily give a general description, but you might not exactly describe a specific which you compare all other dogs. So if you see another dog, you could say that another dog is small compared to your prototype, like heavily, ugly, and beautiful. So let's proceed to readability. So any system of classification should describe specific subgroup of symptoms that are clearly. So the psychological disorder can be those identify readability if the disorder is not readily apparent to both clinical. So the resulting diagnosis might be present bias. So like for example, someone quote some comment, one of your friends might say na, she look kind as sloppy tonight. So another nang po mo na friending na, no, that's just a real funny look. Isa na po ni mga friending na, actually, I thought she was dressed kind of neatly. So you might wonder if they had all seen the same person. So in this case, this should be no readability to their observation, because getting to your friend to agree about someone non-apparent should require a careful set of definition that they called all accept. So let's proceed to validity. So validity, in addition to being readable, a system of nosology must be valid. So we describe validity as whether something measure. So readability and validity are very important component in determining the value of psychological assessment. So ito yung tumutukoy sa pagsusuri sa tinatayang katotohanan o kamalian. So let's proceed to diagnosis before 1980. The classification of psychology as the old age goose had long passed, but a recent history observation of the press. Many of these observations were so detailed and complete that work could make a diagnosis today of the individuals they described. As late as 1959, there were at least 9 systems of varying usefulness for classifying psychological disorder worldwide. So, that person is Emil Kraepelin. So, Kraepelin believed landmark 1913 book. So, that book is the textbook for student and physician. So, it described not only dementia precise, but also food. So, disorder. So, then called manic depressive psychotic. So, Emil Kraepelin, 1856 to 1926, was of the first psychiatrist to classify psychological disorder from biological point of view. So, Kraepelin first identified what we know as disorder of schizophrenia. So next is dementia precox. So dementia precox refers to deterioration of the brain that sometimes occur with advancing age dementia and develop early, that is support to our prematurely. So the term dementia precox is rarely used by psychiatrists or even the patient themselves, the schizophrenia. So, is the accept term for the disorder that was known as dementia precox. So, let's proceed to DSM the third and DSM the third R. So, DSM, which means Diagnostic and Statistical Manual. So, this attempt to take an theoretical approach to diagnosis, relying on precise description of the disorder are they essential to clinical rather than on psychoanalytic. So, when you say DSM the third become a tool for clinician with a variety of point of view. So, it is the specificity and deals with which criteria for identifying disorder, and it had become popular for a number of reasons. So, DSM the third and DSM the third R had substantial impact. So, let's proceed to DSM the third and DSM the third R allows individual with possible psychological disorder to be rated on 5 dimension or access. So, which is access 2 and 3. So, it is consists of any physical disorder and condition that might be present. So, access 4, it is the clinical rated in dimensional fashion. So, next is access 5. So, this framework called the multi-access system allow the clinical to gather information about the individual functioning in a number. So, that's all.